Largo Medical Center is a statutory teaching hospital. We are a tertiary care hospital and deliver a very high level of care.
And then living in St. Pete, obviously the close proximity to the beaches, this is like what postcards are made out of. So like white sandy beaches, warm water. It's just a great overall living experience here.
Obviously the area is very appealing too. I knew it was a place that my husband would be happy because you have the beaches, you have Tampa Bay, close proximity for me to Orlando because there's a lot of different medical conferences there, but also that aspect of the social life of things too.
Largo Medical Center is a Joint Commission certified, full-service 455-bed hospital with 3 emergency rooms in the communities in which we serve. We have 12 operating rooms which offer multiple robotic-assisted surgeries and open heart surgery. We also offer comprehensive cardiovascular services, including TAVR, LVAD, and ECMO. Our Transplant Institute includes liver, kidney, and heart transplants. Our ACGME, Accredited Graduate Medical Education Program, is affiliated with USF Morsani College of Medicine. We offer dermatology, internal medicine, orthopedic surgery, psychiatry, and transitional year programs. We also offer 5 ACGME accredited fellowship programs in cardiology, rheumatology, gastroenterology, pulmonary critical care, and interventional cardiology.
Well, it's a wonderful hospital to work at. It's a very collegial institution within the medical staff itself. There are 120 residents and fellows on campus.
During my 4th year audition at Largo Medical Center, I was so impressed by the quality and caliber of the residents that they had. They were all outgoing and charismatic, and we all treated each other like family.
The hospital culture was something that I actually tuned in on when I was doing my audition rotation at Largo Medical Center. The faculty at Largo Medical Center has been amazing. I feel so blessed to have the trainers that I've had, not only for the educational aspect of things, but also you learn a lot about how you want to practice and interact with patients through those that you're working with.
Well, it is an urban hospital, but we see everything here. We get referrals from all over the state. The heart transplant program for ECMO, and these type of procedures really help people get through the worst diseases. We are a comprehensive stroke center. It prepares them to work in any situation, whether it's an inner city hospital, a community hospital, or a wilderness setting. They really get it all, and they know how to take care of people.
When we brought LVADs into the program, we knew that we were going to increase the risk of small bowel bleeding, and so things like enteroscopy were going to become more prevalent for us. So it was nice to have that exposure and have comfort with that. In addition, we now have hepatobiliary transplant team, so we work with the hepatologist and then also the transplant team, dealing with these very complicated patients that I otherwise would never have had exposure to in practice. The dedicated space that we have right now is that there's a residency lounge, and then there's an area that has a lot of computers where we all kind of work, and then on each floor there's different computers that are available to residents as well. The hospital actually on the 5th floor just had a wing that was added to it, and there's a beautiful conference room area there that we use for our weekly didactic series when we gather together. And then we can bring our own personal computers also that are provided by HCA.
HCA is overall, I think, a great institution. Our voice is always heard as residents, and there's a big focus on resident research and education. I know during my intern year I was able to get my name on 3 publications, as well as present at the National American Medical Association conference, all of which would not be possible without HCA support.
And the scholarly activity that we do is well supported within the hospital system, and HCA, West Florida Division, very active in all the programs.
Having all of the fellowship programs at Largo Medical Center is a huge advantage, not only through the training portion of things, but also into the application cycle of applying to fellowships and getting that constant 3-year-long exposure. So for me, that was a really big appeal.
You want to go to an area that gives you the best academics so you can keep moving forward within your career. Medicine is a career of lifelong learning, and you get that basics here at the Largo Medical Center.
You're going to get excellent training with amazing residents. I think the residents is what truly defines and distinguishes Largo Medical Center, because you will never find these type of residents at any other program, and that's what makes us Largo.